Good morning or good afternoon or good evening whenever you're watching this. I'm going to talk today about plastic surgery under local anesthesia. In my practice, we've been doing big liposuctions for probably 15 or 20 years, always under local anesthesia. And then it evolved to other procedures. It was easy to do upper lid blepharoplasties. We really expanded it now that we are doing facelifts and breast lifts and tummy tucks and body lifts, all under local anesthesia. Yes, I should have started this talk with an apology to my anesthesiologists. We're not using them as much because the patients are coming in, they're not being sedated, they're having their procedure and they're walking out. It's really made it a very pleasant experience, I think, for not only for the patients, but also for the staff, because the tension is sort of down a notch when you have fewer people and the patients are awake and really cooperate with how they turn. And I think that the biggest shock to our patients and even to my staff is how we are able to do a full facelift under local anesthesia. Hence, I would say the fall, we have done about 80% of our facelifts all under local anesthesia. And we've done everything from just the lower face and neck to full facelifts. They're in patients who've never had a facelift, and they're in patients who are having their repeat facelift because they had one 10 or 20 years ago. We do the same operation, we get the same results. The only difference is the patient's awake and talking to us during the procedure if they want, or they're listening to music. And when the operation's over, we put on their dressing and they walk out the door. There's no sort of lying in a recovery room or lying at home in bed for several days. There's none of the nausea, and there's none of the pre-surgical prep as far as going to their doctor, getting clearance or blood work. I think it's great, and the patients are happy, and I think probably that's the future in how we'll do most of our facelift surgery.